Greetings friends, I'd like to thank Dr. Rajeev Sukamran and Dr. D. Chandrasekhar for organizing this TSTC workshop in KSOC District 2020. I hope you'll enjoy this virtual workshop. I'm going to talk about the ninth chapter of this book, which is Human Resource Management. Now, you would have seen the IK standard book, which is a yellow book. That is the base for this talk. And in all NABH book, chapter number 9 would be Human Resource Management. These are my financial disclosures. Very important information in this chapter would be the word employee and staff, which is used in multiple places. The term employee, as far as NABH guidebook, NABH standard are concerned, refers to all salaried personnel working in the organization. The term staff, however, includes everyone who's working in the organization, whether it's a contractual worker, part-time worker, honorary worker, volunteers, fee for service, whatever terminology the hospital may use. Many times hospital says that this person is just going to be, he's not an our employee because he comes only part-time. He comes only when we call him, or whatever way. So all of them are your staff. Anyone working in the organization is staff. So this is the difference. Don't go by the dictionary. This is what NABH says and what we have to accept. The first standard of HRM, which is HRM1, says that iCare organization has a documented system of human resource planning. What are our human resources? We know. So based on our organization, we have to have an adequate number. Like we need to have an adequate number of optometrists, we need to have adequate number of nurses, we need to have adequate number of assistants, whatever people who are working, OT staff, CSSD staff, those kind of things, anesthetists. So this is all again defined by the scope of organization, size of organization. A smaller organization will definitely have less manpower. A bigger organization will have more manpower and more things to be managed here. So absolutely, it's not one size fits all. Based on the size of your organization, you need to have a plan. But this is what we need and this is how we are going to manage it. And especially the only thing is everything is left for the hospital. Nursing manpower is based upon the regulations or guidelines issued by NABH or the government of India or your state, wherever it is being done. So except for that, other things are left to you. Now, the other important thing here is whom you are employing. So for employing professionals, which includes everyone, you need to verify the antecedents or do a background check. Now, this can be done in multiple ways. You can outsource this facility to people or firms who specialize in doing so. You can, do police verification yourself. You can do a background check, which HR has to do, verify the documents to best of your ability. You may check for doctors and nurses in the medical council and nursing council to make sure that, no cases or no strictures have been passed or there is no issue with the council registration, etc. So you have to have plan, and this planning can be for different sets of staff. Like for security staff, a police verification would be definitely a good step to be done. Whereas for probably some other category, like let's say housekeeping, you may not like to do police verification. Based on where you are and how you can do and how your state supports you, please put in a system which really helps you in, troubleshooting people. Because believe me, I can tell you, we have got CVs and we have got degrees which look really authentic for some of the jobs. And later on, we realize that the degree is fake, the letter is fake, the CV is fake, the past experience quoted is fake. So all of us would have had this experience. Please make sure that we do this verification to best of our ability. And like I said, form it for a staff. So let's say you cannot discriminate that I know this optometrist because I got a reference for them or her, I will not do a background check. This person I don't know, I'll do a background check. All optometrists will follow a same kind of background check. All doctors will do a same kind of background check. All security staff goes through a same kind of background check. That is for hospital to decide. HRM2, where we talk about recruiting the staff and orienting them to working in your organization. So the whole purpose here is that there has to be an induction training for every person entering the organization. Leave aside what post it is. Even if it's a director, there has to be an induction training. So induction training preferably should be done when the staff joins, but many organizations will club and pull it together because you can't do induction training on daily basis, but preferably within 15 days to a month, induction training should be given before the staff actually starts working. The induction training should have details about, discussed about your ICARE organization, mission, values, patient rights and responsibilities, appraisal system, employee grievances, leave policies and other things in your place. And you can always have these things and document these things. Along with this, you should also have a specific departmental training. There's a general induction training, but let's say someone is going into OT, then there will be an OT induction training, which is the second part of it. Someone who's going to ward will have induction training for ward. Someone going to, let's say a department will have a departmental training. So induction training will have two parts. One will be a common part regarding the organization, then you will have a specific part where the person is going to work. And important thing here is that we talk about patient rights and responsibility, there's something also called as employee rights and responsibility, which you need to define, discuss, and make employees aware, and which is covered in this element. There also has to be an ongoing program for professional training, because we are talking about quality improvement. There has to be a continual quality improvement, and quality improvement also includes improvement of human resources. So to improve human resources, you should have a professional training and development, which typically would include your nursing staff, your optometry staff, and your doctors, consultant, PG fellows, whatever we want to put, your manpower, how they are going to professionally develop and train. So you need to develop some policy. It could be like, you make sure that once a year there is a refresher course attended by everyone. You can attend a conference. You can make eligible for some training. Okay, you help them with further program. You may help them with doing research. You may help them do a PhD. You may help them to probably write papers. Whichever way the professional development can go. And this is what is expected that we do based on size of our organization. It's not, again, as I told, one size fit all. Wherever you are, how do you improve everyone, and how do everyone learn and develop professionally in the organization? The second part, what is covered here, is the risk in the organization. So there are risks doing, one are occupational hazards and something specific to work being done. That part also has to be taken care of. Like electrical people working in a hospital have the electrical risk hazard. Fire is a common hazard for everyone. So these all things need to be taken care of, and everyone needs to be trained. So you train them for fire hazard, you train them for how to work safely on electricity. Same thing goes for a roti. How do they handle biomedical waste? How do they handle instruments? So we have to have staff specific training based on where they are working and what are the hazards associated with that particular place. And very important thing is when you change responsibility, that a nurse who was working in OT is now working in ICU. Someone who was working in ward goes to ICU, ICU to someplace else. So there is some job specific changes there. The qualification remains the same. But or someone is promoted. Now, whenever these kind of changes happen, there has to be a training which makes that person understand the new role and also briefs him about the new responsibilities and what is expected of that person in that particular area. And this should be documented in the personal file. This is not all verbal. All these things should be documented very clearly. And as I discussed earlier, there has to be an appraisal system. It is important to have that appraisal system for everyone in the organization. No one is left behind. Everyone has to have an appraisal. The appraisal can be done as per organization, which is the predetermined criteria or predetermined interval, but it is at least once a year. So it can't be, you can do it quarterly, you can do it half yearly, but it has to be at least a year. And you have already told employees about it during their induction training. There has to be a disciplinary and grievance handling policy and procedure put into place. Now, these are again required for law. So all these policies should take care into account the law of the land and document how it's going to happen. The employees are supposed to know how the disciplinary action is being taken, what is the process, and the laws typically would be, internal complaints committee, what you have to make, labor law, all these laws have to be obeyed. So what happens, how do you complain to an internal complaint committee? How does the members, or the committee investigates, and how does the action is taken? And as in any course, as per law of land, any kind of disciplinary action or grievance should have a mechanism of redressal, that if I feel that there has been a wrong action taken, how do I redress that complaint, and what is the mode of that redressal, which has to be clearly defined, documented, and made known to all the employees. There is also a HRM 6 standard which deals with the health needs of employees. So all the employees have to be taken care in accordance to the organization policy, and law of land means you have to take care by ESI, good practices, insurance, whatever is dictated and whatever is required. So employee health needs have to be taken care. And also at the same time, the occupational hazard safety also needs to be taken care. And occupational health hazards, again, we are again and again focusing on safety and hazard, because that is the name, that employees should have a safe workplace to work, and all their difficulties have to be taken care of. There is a documented personal information about each staff member. So what we actually do is we make a personal file. A personal file will have everything regarding a particular staff. So let's say my personal file will have my degrees, my CV, my references, my background check, my offer letter, my acceptance letter, my privileges, all that kind of stuff, and my appraisal forms, my additional trainings and all what I do, how do I improve, details about whatever work I'm doing. So all those kind of things will go into personal file. So that has to be maintained for everyone. It's a confidential document. It should be access control. It's not that it's kept in open. Now I go and access everyone's personal file. It will even have your annual health checkup reports in that. So it is all maintained. So when you want to check about a particular employee, everything is in one file. And believe me, after a period, it will be like my personal file now is onto the third file, because I've been working in this place for 12 years. So two files are over, and it's the third file which contains my details. So, you keep on adding and everything is contained there. Important thing would be, you may have some kind of training, evaluations and all going on. Those also goes into personal file. So a personal file is a snapshot about any employee. And every time when we are going to audit, definitely we are going to check personal files, and we are going to check, let's say, a personal file of a nurse, a doctor, an optometrist, a housekeeping staff, and everyone. So, and important thing to note here is that you should also have personal file of outsourced staff. It's not that, it's an outsourced staff, we don't have information. You may have some less information compared to your own staff, but yes, outsourced staff will also have a personal file with information what is required at your end. This is a very important standard. 8, 9, 10 actually are the similar standard. 8 deals with healthcare professional or doctors. 9 deals with the nursing professional, and 10 deals with allied health professional, which in eye care are people like optometrists, people like ocularists, people like visual rehabilitation people, some other kind of clinics which are being run. All those people are going to be covered under standard of allied health professional. This is a new standard only in eye care to take care of the fact that we have lots of manpower which does not fall into nursing and doctor category, and they are being accordingly recognized and given attention in terms of credentialing and privileging. So what is credentialing? Credentialing is the process of obtaining and verifying and assessing the qualification of healthcare personnel. So you verify my degree, whether I really have an ophthalmology degree, whether I've done my fellowship, MBBS, from where I've done, marks secured, all those things verification is credentialing. So you hire a person who's actually having the right degree. It's not a quack. The next step after credentialing is done is you privilege people on what you have to do. So my privileging, because I'm an orbitoplasty oncology specialist, includes oncology, which is not a privilege given to, let's say, all other consultants who work with me. That is why I'm getting those privileges is because of my experience training. So if I've trained in that, I'll get some extra privileges. So based on your training, your super specialty, let's say an interventional neurologist should be doing something which they do. The normal neurologist will not get that privileging. So privileging will be based on your training, your qualification. So the organization will decide that, okay, you have rights to do these kind of procedures, examine these kind of patients, and do this kind of clinical work in the organization. And this is not like the organization says an employee has to accept. So it is by consultation. Privileging based on employee is given. If an employee has a problem with some of the privileging, it is open for discussion, and there has to be a reason why you are not privileged to do something there. Same thing would be in a nursing staff. I will run through that standard where the privileging, how it behaves differently. Like ICU nurse will have a different privilege, an infection control nurse will have a different privilege, a nurse in OPD will have a different privilege. So, different nurses will have different privilege. That's how it goes. That okay, this is a job which ICU nurse has been trained on and can perform, whereas other nurses are not. Like pediatric nurses are separate. So a nurse can undergo a bit of training and work under supervision in the pediatric ward, and then can be given independent privilege of handling pediatric patient. Most of the nurses, it's not one size fits all that everyone will be able to handle pediatric patient. So those kind of things we have to take into account and give privileges differently. Then there's also a question of privileging for trainees. The first year PG, second year PG, third year PG fellows, they will also have certain privileges, and they are different. The first year PG will not have the same privilege as a second or third year PG. A fellow will definitely have much more privileges than a PG. So even if you have fellows, trainees and all, they also need to be given privileges and very clearly document this is what they can do. And needless to say that based on your privileging is how you handle patients. This is again the repeat of the standard, but here it is with nursing. So same thing, you verify their nursing degree, you verify their training, accordingly give them privileges and postings wherever, whatever they are capable of. And same thing, they are again going to do the job for which they are being privileged. And the similar thing is now with the allied healthcare professional, where you are going to give privileges to optometrists. Now, we give privileges to optometrists for pediatric examination who are trained on that. Every optometrist does not do that. Similarly, for contact lens, we have privileged few optometrists. For doing certain other procedures, we privilege someone. So based on what you have and based on your optometrist training, you can train them. Same thing will go for, let's say I would give my ocularist the right to examine and dispense artificial eyes. That right is not given to other people. In fact, I'm using a wrong word, not a right, a privilege. So she or he has the privilege of dispensing artificial eyes, other people don't have. So like that, you will be able to give these privileges to your allied health professional, and you will not get a non-conformance saying that what is their qualification, why they are doing these things, they are not nurses, they are not doctors. So this has been an issue in non-eye care standards, whereby allied healthcare professionals have not been given their due, and many a time NCs have been raised for that. So here now, the allied care professional, once you privilege them, will be able to assist in patient care, which is a problem in all other standards, and it's a problem which is affecting our specialty the most. And that would be end of my talk. Thank you for your kind attention. I hope this is useful to you. Bye. Take care.